All right, let's dive into a really powerful and important medication, azathioprine. Now, if you or someone you care about has an autoimmune disease or has been through an organ transplant, this is a name you might know really well. So let's break it all down.
Think about this for a second. It's a pretty wild question, right? Our immune system is designed to be our ultimate protector, our personal bodyguard. But what happens when that system goes rogue and turns its weapons on the very person it's supposed to defend?
Well, that's exactly the situation we're talking about. It's like a civil war is breaking out inside your own body. And in this war, the enemy is your own overactive immune system, a defense force that's gone from protector to aggressor.
And this war is fought on two main fronts. On one side, you've got autoimmune diseases. This is where the body's own immune cells get confused and start attacking healthy tissues, like what happens in rheumatoid arthritis or lupus. Then on the other side, you have organ rejection. Here, that same protective instinct sees a new life-saving organ like a kidney or a heart as a dangerous invader that has to be destroyed. In both of these cases, the objective is the same. You have to find a way to calm that immune response down.
Okay, so how do you actually call a truce in this internal battle? You need a pretty special tool, right? Something that can disarm those overactive immune cells without completely shutting down your body's defenses. And that tool is azathioprine.
So what is this stuff exactly? Well, the first part, immunosuppressive, is pretty straightforward. It suppresses or dampens the immune system. But the second part, prodrug, that's the really cool part. It means the pill you swallow is actually inactive. It's like a sleeper agent that only gets activated once it's inside your body, which allows it to be much more targeted.
And you can see here just how versatile that sleeper agent is. It's an absolute cornerstone for preventing the rejection of transplanted kidneys, hearts, and livers. And it's also a major player in the fight against a whole range of autoimmune diseases, from rheumatoid arthritis to inflammatory bowel disease, which you'll often hear called IBD, and even lupus.
Now listen up, because this is a really crucial point. Azathioprine is not a quick fix. We're talking 6 to 12 weeks before you might feel the full benefits. This is why doctors often start it alongside a faster-acting drug, like a steroid, which they can then slowly reduce as the azathioprine really kicks in. So remember, it's a marathon, not a sprint. Patience is absolutely essential here. So what is actually happening inside your body during those 6 to 12 weeks? How does this medication do its thing? Well, you can think of it as a highly sophisticated, top-secret, cellular sabotage mission. Let's walk through this mission. Step 1 is activation. That sleeper agent, the prodrug, gets converted into its active form, a molecule called 6-MP. Step 2, infiltration. This active molecule now sneaks into your body's cells, pretending to be a normal building block for DNA, and it especially targets cells that are dividing rapidly. Step 3 is disruption. It gets onto the cell's DNA assembly line, but it's a fake part. It jams the whole system, grinding production to a halt and stopping the cell from making copies of itself. And the result? Step 4, suppression. The cells that were dividing the fastest, those aggressive, attacking immune cells, get hit the hardest. Their numbers plummet, the attack slows way down, and that internal civil war is finally brought under control.
Of course, any medication powerful enough to do all that is going to come with some risks. It's not a perfectly guided missile. It can cause some collateral damage, and understanding these risks is absolutely key to using it safely.
We can really split the side effects into two camps. On the left, you've got the common stuff, like nausea or diarrhea. Not fun for sure, but often manageable. But on the right, those are the serious risks we have to be really vigilant about. Because azathioprine slows down cell division, it can affect your bone marrow, where your blood cells are made. This can seriously lower your ability to fight off infections, and that is a huge deal.
And this brings us to the absolute non-negotiables. These are the red flags. If you experience any of these things, like severe belly pain, which could be pancreatitis, a high fever or other signs of infection, any weird bleeding or bruising that might signal a drop in your platelets, or yellowing of your skin or eyes, which points to liver trouble, you have to call your doctor right away. This is not a wait-and-see situation. So, with all that in mind, how do we use this powerful tool safely? Well, it all comes down to a safety checklist and a really strong partnership with your healthcare team. It's all about being proactive, not reactive. This quote says it all. I really want these two words to sink in for you: meticulous and lifelong. Being successful with azathioprine isn't just about remembering to take a pill every day. It's a long-term commitment to a whole system of safety checks that are designed to protect you. So the very first safety check usually happens before you even take your first dose. It's a simple blood test for an enzyme called TPMT. This enzyme is what helps your body process the drug correctly. As you can see, about 90% of us have normal levels, but about 10% have intermediate activity and might need a lower dose. And a tiny fraction, just 0.3%, have very low or no activity at all. For them, a standard dose could be really dangerous. So this test is absolutely critical to finding the right, safe starting dose just for you.
Here is another make-or-break safety check: drug interactions. And the biggest one, by far, is with a common gout medication called allopurinol. If you take these two together without making an adjustment, the levels of azathioprine in your body can become dangerously high. The rule is that the azathioprine dose has to be slashed to just 25% of what it would normally be. This is why it is so important that your doctors know every single thing you're taking.
And finally, this is what that lifelong monitoring we talked about actually looks like. It means getting regular blood tests to keep an eye on your blood counts and how your liver is doing. It means getting regular skin checks, since long-term use can raise the risk for some skin cancers. And it absolutely means having a serious, in-depth talk with your specialist if you're thinking about pregnancy. This isn't just a to-do list, this is your personal safety net.
So, when you boil it all down, here's the bottom line. Azathioprine is an incredible medication. It can restore balance and it can literally save lives. But that power demands respect and it demands vigilance. The real goal here isn't just to take a medication, but to build an active, informed partnership with your healthcare team. The question is, are you ready to play your part?